Hello, everyone. My name's Mark Davis. I work at Monash University. I'm medical sociology lead for the Centre to Impact AMR, and I work in the School of Social Sciences. I'm the lead on the sociology of antibiotics and the antimicrobial resistance crisis, and I'm using this video to provide a short overview of our project as we finish it this month and this year. I want to thank my grant holders and research fellows who've helped make this project possible. We work at Monash University, but also the National Centre for Microbio Stewardship and the universities of Strathclyde and Copenhagen. Just to give you a sense about the direction of the research, the aim for this particular project was to understand the tacit, the hidden, taken for granted, everywhere but nowhere practices of antibiotic prescription and how they influence capacity to manage the reduction of AMR. We had three basic questions. How do experts conceptualize the field? How do they think about the social and economic aspects, the hidden drivers of antibiotics use, and how can they be addressed? We also wanted to talk to providers, so general practitioners and veterinarians working in the community and members of the general public about their experiences with using antibiotics and how they might be able to work together to address these issues. And we wanted to integrate that material into thinking about how, what are the social factors that can help and or that hinder the reduction of antibiotics in community settings. So this was a sociological qualitative study led by social scientists in collaboration with physicians and veterinary medicine experts. So we interviewed a whole range of experts in the field. We spoke with patients, pet owners and prescribers. And we also took the step of forming workshops with patients, pet owners and prescribers to kind of add another layer to our research inquiry. We were able to speak with 51 experts, most in Australia, but 6 from the UK. And we did that to understand what was specific to Australia or general to Australia by also speaking with some experts overseas. To do this, we identified 109 individuals from 58 organisations working in Australia and the UK, from government, university, hospitals, royal colleges, professional associations and peak health agencies. We also then spent time recruiting members of the general public living in Melbourne who'd had recent experience, the previous 12 months experience of using antibiotics for themselves and or pets, or both, as it happened. We also spoke with 20 general practitioners and 17 veterinarians. So this is a sizable, rich, qualitative data set. After we did our interviews, we also formed workshops with patients, pet owners and prescribers. We did 3 of these based on the themes of risk management in prescribing, the economic drivers of prescribing, and trust and the therapeutic relationship and its impact on risk and economics, actually. So these themes came out of the data analysis of the interviews. And what we sought in the workshops was, helping, members of the general public and prescribers, helping us to kind of reanalyze our materials, check our understandings, help us notice things we hadn't noticed, and also to have a kind of cross-prescriber consumer conversation about possible solutions and remedies to the situations we found in the interview. So we're madly publishing at the moment, and we've had some outputs already, as you'll see later on in this presentation. but we thought it was salient to give you a kind of a taste of the kind of key findings that are coming out of the work. Each of these is supported by a publication in either in press or published already. We explored One Health discourse, and we found that while One Health has scientific and technological kind of ramifications, it was also understood as a social practice that if effective, was supported by respectful interactions across disciplines, and that these interactions need to establish and sustain trust and shared understanding. In some corners of the field, this might be referred to as epistemic or collaborative humility. Our work with patients, pet owners, and prescribers found that they are supported, but they want more support to manage the infection risks that are salient in their lives and in their practices, and the uncertainties that prevail. Not all prescribing moments can be anticipated, coded. Guidelines only get people so far. So how to manage uncertainty and sustain high quality care is something that our participants talked about. There's also some issues here around norms of blame and responsibility that can lead to a kind of reflexive use of antibiotics. So not only is AMR a problem, but the kind of social moral peril that prescribers might face if they do the wrong thing, over-prescribe, under-prescribe, is shading how they think and feel about their practices. So it feels like we need ways of lessening these norms so that prescribers can be free to make the best clinical judgments and not face social ramifications for the work they do. Another set of issues, and this is probably not surprising, but does need to be factored into our policy and communications, is that economic systems are complex. The economic systems that shape prescribing are complex, and there are more people than just prescribers and users there. Practice managers, childcare managers, and other people are also influencing how and when people seek advice around infections and whether or not they're able to use antibiotics. So we're thinking that policy and communications needs to widen its gaze and think about the economic systems that deliver antibiotics into communities and enlist the cooperation of the other players in these domains. We've sought to create a final report for our project that's slightly different from what we've done in the past. And you'll see when you consult the document that it's mostly qualitative materials based on themes that came out of our work. The Antibiotic Stories is designed to alert the reader to the uncertainties and the social ramifications of prescribing and how to manage those that occur for patients and prescribers and pet owners. So this is not prescriptive. There's no magic bullet, but we're using the qualitative material to help other practitioners, patients, patient advocates, policymakers, and communications experts think about how to best assist individuals to participate in the management of AMR. I really want to make the acknowledgements necessary. This project was successful because of the interviewees and the workshop participants who gave their time and thoughts and expertise during the pandemic when we were all thinking about other things. We're very grateful for that participation. Our reference group members also helped guide the project, and we really appreciate that expert help. The Australian Research Council obviously needs to be thanked for funding the research, but also the National Centre for Antimicrobial Resistance at Melbourne and Monash, the Monash's Centre to Impact AMR, have supported this project and it wouldn't be what it is without that support. We also had help from CSIRO's Minimizing Antimicrobial Resistance mission. They've helped support the dissemination strategy for the project. So very thankful to all those participants. This is a list of the publications so far. These are all available digitally, and if you aren't able to access them, please do get in touch and we can assist you with that. Thank you very much for your time and attention.